So I just got here early, so we started the conversation a little early.
Sure.
But Lauren is here from the Disability Network, and they have some amazing resources in the community. So we were talking about how, you know, food stamps have been cut back, cost of living is barely keeping up with the increases. And so there are a lot more of these issues with, you know, making sure food is available, prescriptions, coverage, medical access. And so I said a big piece of my job is making sure when people have problems that we can put them in touch with resources in our community. So I'm going to turn it over to you.
Good afternoon, everybody. I'm very happy to be here. Thank you for inviting me. I work for the Disability Network of Oakland and Macomb County. There are 15 disability networks in the state of Michigan. We are the largest. We are state and federally funded. We are a nonprofit agency, and we assist people all ages and all disabilities. And that's what makes our agency unique. It's not a specific disability such as breast cancer or epilepsy foundation. So 1 in 5 people in the state of Michigan, I believe nationwide, 1 in 5 people have a disability. You may newly acquire a disability and not know where to turn. So one of the core services we provide is information and referral. Monday through Friday, 8 a.m. to 4 p.m. If you have a question, if it's for yourself, a friend, or a family member, you can give us a call and we can get you connected to the specific agency based on your disability. We get a lot of calls. People need assistance paying bills, utility assistance, rent, and an emergency that may come up. We don't, unfortunately, have any funds available, but we can recommend the steps to take to try to get the funds. Either apply for state emergency relief from the Department of Health and Human Services. I can give phone numbers to local Salvation Armies or other churches that may have some funds. So we can be a good resource if you're Macomb Community Action. We often refer to that agency as well, government agency. So the services that we provide information and referral. We can also provide advocacy. If you need to apply for Social Security disability or Medicaid or anything through DHS and you just don't know where to begin, we can work with you. You can come to our office. We are located in Troy at 15 and John R., or we can come meet with you somewhere closer. So if you live in Macomb County, we can meet you at a local library, and we can even come to your home if transportation is a barrier. So that's a nice service, and it is free of charge to help navigate those systems. I've been here for 7 years. My background, I was an elementary teacher, and I really enjoy the work. I work with this agency because we do so much. We're in local high schools. I taught special education empowerment classes. We have a veterans program. We get referrals from the VA. We have a program here, if you're a veteran and you are homeless or on the verge of being homeless, it's called Project Home. And there are funds available to help locate housing for veterans. So that's one of the programs. We also offer a Medicare Medicaid assistance program. So during open enrollment, which is in October through December, there's a woman at our office who can meet with you to look at the drug plans, perhaps if you qualify for lower, I think it's through Department of Health and Human Services for your Medicare plan. So that's a service that we offer free of charge. If you're in a nurse, if someone is in a nursing home and has Medicaid and they're ready to be discharged, there's a program called Community Transition Service where we can come out, do an intake if the patient has Medicaid, help locate housing, pay first month's rent, buy furniture and everything you may need to live independently in the community. So Community Transition Service is a program we offer. Assistive technology. If you're having problems with dexterity with your hands or some vision problems, there is a woman who can come out to your home or to a park tower, a facility like this, and do a demonstration of these assistive technology devices. There are can openers, things that can reach on a shelf that may help you. They don't we don't sell the items, but we can give you the list of where you can purchase the items, and usually they're usually low cost, around Amazon or somewhere else, Bed Bath & Beyond, where you can purchase some of those items. So assistive technology, Medicare. I have all of the core services that we offer. So if you want to take any of these program brochures, we have independent living skill training. Michigan Rehabilitation Services partners with us. So if somebody is in need of learning how to cook or to clean, we have a kitchen at our facility in Troy, so we teach independent living skills. Peer support, advocacy, information and referral. And I'm also a member of the Regional Transit Authority and the Smart Buses Citizens Advisory Committee to make sure that bus stops are accessible. So I think that's pretty much the services we offer. Any questions about the Disability Network?
This is one important to know for you, if it applies to you directly. To you live in a community where, you know, people's situations are changing, and, you know, if you hear someone asking about some of these issues, now you know where we can get them.
Yeah.
So I ask that you help spread the word. Maybe we can hand out those,
Yep.
so everyone can take them back with
Sure.
them to their apartment.
Yep.
And, you know,
Pass these out first, and then I'll get the other ones.
yeah. Any specific questions about any of those programs?
Did you
It sounds like it might be beneficial, Eleanor, with the Medicare and Medicaid.
We've had Disability Network here before.
Yeah, I think of the
And,
nursing.
one of the things, as far as the Medicaid and Medicare systems, Jessica and I do that.
Oh, okay.
We have that, but they do a lot of things that we don't do. So yeah, we've had them here before.
Fantastic.
And we had one person from Disability Network that brought out a lot of gadgets and demonstrated with them how they work when you have problems with your hands. So yeah, we're quite familiar with Disability Network.
Fantastic. Well, it sounds like with open enrollment for Medicare and Medicaid, if people need those reevaluated to make sure you're getting the right coverage. But there are programs out there. I encourage you to reach out. Like next time you go and pick up your prescriptions, there are things that the pharmacist can't tell you unless you ask. So making sure you ask them, can I get this cheaper? Is the generic cheaper? Is there another location? You know, if you ask them, they can then tell you, oh, Costco, you can get this cheaper. You know, is a mail-in prescription cheaper? Sometimes multiple months can help offset the cost of that. Sometimes mail-in rebates that companies, if they know that their product is a high cost, can help offset that.
We got a great program they have. We did fix them their medications and try and check them if we can find lower brands for them. And then we have some residents here who are very smart about their medications and how to take them and where to get them. So we try to share as much information as we get. So we're glad that you're coming to bring us more because with the climate like it is now, we need all the information we can get.
Absolutely. Very fortunate to have resources in the building because a lot of times people spend a lot of time on the phone waiting for access. So
Yeah, they put us on hold.
definitely having someone.
Why is that? When you call them up and you want to talk to somebody, they put you on hold. You on hold for hours and hours.
Usually it's because there are so many people that they were helping. We need to hire more people to serve in the community. Like I said, 700 to 900 cases. That's
Yeah, but they put you on hold for a period of long time. Nobody come back to that phone. You still on hold. And I'm saying,
Yeah, I've had
somebody
people-
to answer you, and then if you can't take care of me, just let us know. But the time they constantly have you on hold.
Yeah.
You wait like hours and hours to be on hold.
yes. Reach out to my office if you're encountering that. Because you know what? I have a couple, but you have my contact.
Yes, I do.
Okay, I'll take one.
I have, if she doesn't have a card, I have a number.
Yeah.
Would you give us your number now?
It is 517 323 1772.
Thank you.
Yes.
Extension?
Nope, that's my office.
Okay.
I'm going to pass out the
Yeah.
Medicare, Medicaid program flyer with the contact, the name of the woman in my office who could help you with that too.
Fantastic.
Yeah.
And you write down the number.
And for those of you who don't get Laura's phone number, call me, I'll give it to you.
517 323 1772.
State representative. Got it.
Yep.
Thank you.
So what else? What else is on hot topics?
You need help,
The
kid.
bus.
You need help.
They went up $2 on the
You
bus.
need help.
The what?
They went up $2 on the bus when you ride the DOT transportation bus.
DOT transportation.
And smart, but it's $2 to ride the bus now. Yes.
And a lot of times the logistic, transportation has been horrible.
Yeah, it's
They
been,
people
rude.
miss their appointments. One lady, and I saw this on the news, where they took her to a doctor's office and she stayed there after her appointment 4 hours. She called the news and they came and see her.
Before the.
Yeah, that was.
Well, that's another thing that we're not investing in. We are trying to save ourselves money as a community on the whole. I'm speaking, and we're not paying. But you go to Seattle, you go to New York, they have
Good
grade A
transportation.
community, public transportation, and you look at our community who depends on it, and we don't invest in it. We don't pay for it.
I'm saying that because most of the time you get on the smart bus and it be full and they pass you up and we have to wait an hour and a half for another bus. And then they be very rude when you get that bus.
I just met with DOT 2 weeks ago, and so that's
Okay.
yeah. But I will set up another one and find out where we're going, what's up with budgets, how much is that can be expected to change.
Yeah, so is the prices gonna go up on the buses again?
I don't know. How recently did that change?
Since they started last year, it's $2 to ride the bus.
Okay.
Before it used to be 50 cents, you add a quarter to get a driver. Now they got it where you pay $2 and get a 4-hour pass.
Okay.
So, in between that, hopefully it don't go up no more, cause people, like you said, we on a fixed income, can't nobody afford that unless you got a red or white and blue card, cause I ride the bus for 50 cents now, but how long?
What's
you
a red,
take?
white, and blue card?
Your Medicare card, your Medicare card. But even with that, you pay that 50 cents, they give you a 4-hour time, cause the busman said it's gonna go up again, and it shouldn't go up.
No, not this one. They just did it.
It usually they reevaluate every year what their income, how much and then change it. So this should be at least a year, but I'll ask.
Okay.
Yeah.
What we gonna do?
Please know that I am advocating for more resources for investing in public transportation. I see it. I know it. I'm trying to convince my colleagues that every community has low-income people. Whether you're in UP, Petoskey, doesn't matter. Lansing or Grand Rapids or Jackson. So this should be a priority for every representative. Yeah. Unfortunately, for some of us, this is a priority. For some of us, this is not their priority. And I don't understand if this is the experience of people in their community, how are they not advocating for them?
Isn't the voters supposed to vote on this if they go up on the bus fare?
That I think can be changed by Department of Transportation it's like cost of funding increase, cost of living increase. And that's what kind of
They
we
don't
were,
let us vote for that.
they don't, but here's the problem. If they don't change the prices, they can't afford buses or gas or drivers, and then we wouldn't have anything. So it's one of the challenges that we have to do. We have to increase funds because that money is worth less and less over time. Yes, is it Sylvia?
That's the importance of voter registration.
Thank you.
And that's what I want to say.
Thank you. I apologize, Sylvia. I didn't see you back there. Yes.
And we
Great.
Absentee voting.
Lori, you do have a lady coming out to see us.
Yes, Lori Arts.
I think it's October I'll decide, but I'll let her know.
Yes.
She's coming out for voter registration.
Thank you.
And for those who can't do it, she'll help them, but she will be bringing it back.
Wonderful.
Yes.
So she'll be.
But Sylvia raises a really good point. Votes matter. Votes count. Votes are your voice.
Oh, yes.
And so your vote counts. Make sure you're registered. Make sure you take the time to vote. Also, reach out to friends and family. They know what you're dealing with. Ask for their support when picking representatives. Are they, local? City council makes decision as far as smart buses. Yeah.
I guess the other thing that I'm really concerned about is our residents who make that much money to be living well, but income is a little too much where they don't get Medicare and Medicaid. That group of people, if you're making $1,200 a month, and you gotta pay your own Part B Medicare, and your rent is a little higher, and you're not getting as much in your food stamps, and it's a catch-22 for them. Because when they get sick, they only got Medicare. And then most of them can't afford, an additional income. And some of the insurances are just too expensive.
It's true.
So I think it would help if they would raise the amount of who qualifies for Medicaid. Because right now it's kind of.
Let's go back to where your vote is your voice.
That's right.
We know that at the federal level,
And that is
people
federal.
don't value having universal health care, having affordable health care, and they have cut subsidies and they've cut support, but they answer to you. And so making sure that where you put your vote is someone who represents your interests. So do your research. There's a lot of organizations out there, League of Women Voters, who are nonpartisan. It's not by party. And you can look at what issues are affecting you and what candidate represents. Because what you say on a news bite or what sounds good, is that actually how you vote? Is that actually how you put it into action? So being informed voters.
Is the lady from the Disability Network still here?
Yeah, Lauren's here.
Okay, because she asked if there was any questions and I raised my hand.
Oh, yes. Sorry about that, I was passing out the information, yes. What
Okay.
can I answer for you?
Now, you said, was it October to December was,
I believe those are the months for open enrollment for Medicare.
okay. Now, so if I went to you guys to ask you what was the best insurance for me, you'd be able to help me with that?
I don't know, they can look at your drugs you're taking and try to find the most affordable plan. And I'm not sure, so I can't speak.
Because I don't know what the other ones offer.
Yeah, so
'Cause I
Miriam,
was thinking
So
about
is
jumping
she a
plans.
navigator?
she is, but
Okay.
she's actually on medical leave for a couple months, so the calls that we do get until then, my coworker Mark, he is being trained to be one, but we would refer you to the Area Agency on Aging
Okay.
until Miriam comes back for their Medicaid, Medicare assistance program.
Because I'd want to know who's compatible with like Beaumont.
Right.
You know, like one of my a couple of my doctors.
So Miriam, I hope she's back soon because she's been with us for 12 years and she has so many appointments. She's helped many people, so I hope she can answer that for
So
you.
am I supposed to make an appointment?
You would call her and I think
Do you have the flyers?
Yep.
Reach out,
What's her
call
name?
the,
It's on the name right here, Medicare Part B, Miriam Green. I have you just listed her name and her number.
and like you said, if Miriam is not there, they'll find a navigator for you. But you can tell them like what conditions are you dealing with, what prescriptions, and they will help you pick the one that's going to give you the best.
Well, I need something that's compatible with one of my doctors.
Okay. And she could
And
do
Beaumont,
research and look
not
at it.
down here.
Sorry I didn't answer it sooner.
Because I just made it all inclusive.
Right.
Yeah.
You know.
Do you have a question?
Medicaid and Medicare just passed out a book. I don't know if everybody in the property still got one of what they cover.
Oh,
Yeah.
that's nice they offer that here.
They should have mailed you one. I know my dad just got it. He said the prices went up again. So I said,
Do you have bus tickets?
I don't. We don't have them.
You know, if you fill out the form for SSI for SMART, they won't give it to you. If you fill out the eligibility form,
The ADA.
no. No, the form that you're eligible for SSI for your disability.
Oh, okay, because they have they have the application from Smart's website, where you take your doctor, and your doctor will fill
No.
out.
No.
I'm not familiar with the
That's the
SSI.
it's the second part.
Okay.
Okay. This is like the first part where you don't need your doctor. Well, what it is you can't use that form that you're eligible, that you've been approved for SSI. What you have to do is you have to give the award letter that shows the actual amount.
Okay.
So what they write what you need is actually quite different, because they sent it back to me. And then I called them and they told me you need the award letter.
Maybe it would be helpful to have someone from Smart come.
So they're,
That's a good idea.
they wrote it in there wrong, so it just got booted back, and I thought, a lot of people are not gonna end up going to their doctor
Right.
for that, because they have to make a special trip now, when they're actually eligible.
Yes,
When they
and
have
the big
SSI.
piece is getting the reason why, if it's been kicked back to you, because I've had people, they had something filled out incorrectly. It didn't mean that they were ineligible or couldn't receive
Yeah,
it.
I can actually show you the form.
Yeah. So reaching out and asking for an explanation why.
Yeah, in other words, I said I met all the criteria. I did, I met all the criteria. It said, your determination letter. And I gave them the determination, and it said, no, it's not good enough. And I said, well, what do you mean? And they said, you need help if you're collecting it. And I said, I was already approved, that's all you asked.
So call my office
Okay.
on Monday. Dawn, who is here setting up, will ask you to send her approval to advocate on your behalf. It's a written release form. And then she'll reach out to that department
That's fine.
and she'll collect the paperwork and make sure that she's connecting you with it.
Okay.
Yes.
I had a handicap sticker,
Okay.
okay, and I didn't use it for quite a while because at the time I could walk. So, last year I took my old sticker down there and she run it through the machine. She says, honey, it's not even in the machine. It's got to be.
This is at the Secretary of State for your
Yeah.
vehicle.
I went to Secretary of State. I had to go back to my doctor. He wrote out another one, and it's for life. I don't.
Okay.
You know, every so often you gotta give it renewed. And she said it was very funny that they never notified me that was
Needed
no
to
good
be-
no more.
Right.
Yeah.
That's the first I've heard of that.
Yeah.
Not notified. Yeah, how were you to know?
Yeah.
Needed it.
Because my doctor said, it's right on your chart that you, I already, signed, you got one. I said, yeah. It was so old. It was
Yeah,
not even-
sometimes you just gotta get you that documentation renewed.
Yeah,
Yep.
so mine now is for life.
Good.
Good. Well, if you guys don't, if you have any more questions, I'm gonna go sit back there, but I'll be here at the end, so if you wanna talk with me, and I have the flyers for the veteran program, the assistive technology over here. I wasn't sure if everyone was interested in those, so I'll be
Yeah.
here.
Maybe if you can leave some extras with Eleanor so that you'll have them on hand. You probably have a lot, yeah.
No, I'll take some more.
Yeah.